Which of the following test is most appropriate to confirm suspected diagnosis? Okay, these are just some tests. All right, 60-year-old woman presents to the clinic with a 6-month history of fatigue. Is that okay what I'm doing? I'm just like glancing at the answers, right? I'm not like
Yeah. You're glancing at it
okay.
and just in your mind, right? I want you, I mean, you don't have to say it out loud, but when you glance at it, you have to, in your
Mhm.
mind, you have to ask yourself, what am I dealing with? Right? Like, okay, bone marrow,
Right.
folate. So you're like probably a hematology thing, right? By reading this.
Yeah, I was thinking like anemia, right? Folic acid, the
Good,
MMA level. I'm like, okay, I'm just thinking like anemia world or something like that
good,
before
good,
looking at
good.
anything else. Okay. Presents to clinic 6 months through fatigue, weakness, and paresthesias of her hands and feet. She also reports difficulty maintaining balance. On examination, her tongue appears smooth and beefy red. Um, Complete blood count reveals macrocytosis. Serum vitamin B12 are found to be low. Okay. Um, so it sounds like she has a macrocytic anemia, especially with her tongue appearing beefy red, and then she's inability to maintain balance. Um, to confirm the suspected diagnosis, I know that with if her B12 is low, like the difference between the folic acid and the B12 test is that MMA test, so that methylmalonic acid. Because I think that's what's going on here. I don't see if it why it would be anything else
Okay.
except maybe the folic acid, and I'm like ruling something out. But I'm pretty sure that if B12 is low, either this MMA is high or low. It's not the it's and I know with the B9 it doesn't affect it. That's how you rule out B9.
Okay.
But that's all I
Fine.
really know. I mean, I could be missing something, but
Sure. Okay, so this is interesting here.
okay.
Okay, I'll talk to you about it here, and it'll make more sense.
Okay.
So your idea is correct. The
Okay.
methylmalonic acid level management, right, or the levels, right? What will that
Mhm.
how do I say this? What will that compare and contrast?
B9 and B12.
Yes,
Macrocytic anemias, right? Yeah.
exactly. B12 or folate, right? Pretty much, right?
Mm-hmm.
So in
Mm-hmm.
your mind, right, do we need to compare that? Right? They already
Well, not well, kind of no, because the B12 is already low, so you already kind
exactly.
of know in
So
that
now the
direction.
question
Okay.
is, right? The next question is, why is the B12 low? You understand what I'm saying?
Oh, because she can't absorb it.
Yeah.
Okay.
So out of this list, there's only one answer that gives you the why, right?
Okay.
So D and B, right? Folic acid can help you say, oh, okay, is there some folic acid deficiency also, right? And then D can help you say folic or not, but they already told you that B12 is low. So then they're trying to really ask you, okay, like what is the why, right? Why is the B12 low? The only one that will answer that right here is going to be C, because then you have, if you have pernicious anemia, then your B12 is low because you can't absorb it, right?
Okay.
Does it make
Okay.
sense?
Yeah, that makes sense. I guess I know gastropareil, so I do the immune disorder.
Yeah.
Okay.
So
Okay.
it's
That
the
makes sense.
why. It's the why. Okay.
Okay.